saan tayo magsa-start, Danry? Sige, naka-mute ka.
Miss Pat, sa introduction tayo ni Miss Dr. Abad.
So, mag-i-introduce ako kay Dr. Abad. Ito na yung slide nyo na papakita.
Yes, ma'am.
Okay. Hindi nyo napapakita yung full picture niya.
Ma'am, papasok si Dr. Abad doon sa part sa script nyo na, wait. After nung Philippine General Hospital, her thorough training, papasok si Dr. Abad doon.
Okay, so can we practice for your transition also? We'll just do it in like 2 minutes para mag-open doors na tayo. So after I introduce after I thank Dr. Art, who will be delivering his video message, ang papakita natin sa screen is the event screen, the event slide. Danry?
Yes, ma'am.
Hindi na natin pa-practicein ngayon yon.
Practice na natin, ma'am. Wait lang. Hinahanap ko yung access video. Carlo, parang hindi ko makita yung ano ko. Share screen ko.
Co-host ka naman, sir. So, you should probably see your share screen at the bottom. Yung green.
Dapat stop share muna si Dr. Abad.
I'll stop muna.
Yes, Doc.
There po.
Okay, Miss Pat.
Okay. So Danry, just to be clear, so basta Dr. Abad, you don't touch your PowerPoint now. Once you share screen, that will show na naman your first slide. So I'll introduce you, and then Danry, by the time I finish saying Philippine General Hospital, that's when you will end share screen, and Dr. Abad will be the one to start her share screen.
Yes, Miss Pat. Doc Abad, ang keyword po is Philippine General Hospital.
So when I hear that, I'll start sharing my screen or I'll start the video?
You'll start sharing your screen.
I'll start sharing the screen. Okay.
Yes.
So I'll look for my slides now. Okay.
Okay, so let's try that. Our speaker for today is an infectious disease consultant for the Medical City, Infection Control Committee Chair for the Medical City, Research Collaborator, Assistant Professor at the Mayo Clinic, and Clinical Associate Professor at the Philippine General Hospital. Her thorough training and experience in infectious disease and control is crucial in providing practical pointers on how to integrate COVID-19 prevention habits into your regular routine. Ladies and gentlemen, Dr. Cybele Abad. Hey, Dr. Cybele, so you turn on your camera. So after I introduce you, Dr. Cybele Abad, then you can turn on your camera also so we can be on split screen.
Okay. It's on.
There you are. Yeah, that's right. So Philippine General Hospital, start your share screen. And then once I say your name, ladies and gentlemen, Dr. Cybele Abad, then you come on. Dr. Cybele, I'm just going to say, Dr. Cybele, I'm really excited for this talk. So please take it away. And then I stop my video and you can continue talking.
Okay. All right.
There you go.
Isa pa, ma'am. Last one. Last one, ma'am.
Okay, and then we have to open doors.
Yes, Miss Pat. Last one. Stand by, Miss Pat. 5, 4, 3, 2, anytime, Miss Pat.
The speaker today is an infectious disease consultant, assistant professor at the Mayo Clinic, and clinical associate professor at the Philippine General Hospital. Her thorough training and experience in infectious disease and control is crucial in providing practical pointers on how to integrate COVID-19 prevention habits into your regular routine. Ladies and gentlemen, Dr. Cybele Abad. There you are, Dr. Cybele. Thank you so much. Looking forward to your COVID-19 update.
Okay tayo, Miss Pat.
All right. Thanks, everyone. Quick prayer, if you don't mind.
Yes, please. Sure.
Father God, we thank you for this opportunity to once again put forth our talents and our resources for you and for your glory, Lord. We pray that you please guide Dr. Abad and what she will be sharing that will definitely help people prevent getting sick because of COVID. And I also pray for Dr. Nicole, Father God, will you continuously guide her as she sifts through the questions along with our group. For the Q&A group, we pray for MaxiCare and its members, the management, and everybody who's involved here, particularly our production and tech team, Lord. Please override all of our preparations, Lord, as we offer this wonderful webinar for you. And Father God, we just ask that you be with us all throughout. And we ask this and your guidance in your holy and mighty name. Amen.
Amen.
Thanks, guys.
Amen.
Thank you, Pat.
Hello, playback video, standby. Turn off na po tayo ng mga microphones natin. Thank you.
May naka-share screen. Ikaw yun, Danry.
Yes, ma'am. Yes, ma'am. Carlo,
Okay.
anytime, pwede mo nang kunin.
Pag na-aksidente, sagot ka ng e-Ready, ang first prepaid emergency health card from MaxiCare. Sagot ng sakit ng katawan, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready.
Kanina pa masama yung pakiramdam ko. Obo. Sipon. Masakit ang ulo. Nilagnat na rin yata ako. Sa tingin ko, hindi ko na kaya pumunta sa ospital. Dok, anong gagawin ko?
First of all, you really need to rest. Kailan nagsimula pananakit ng ulo at pag-ubo mo?
Kahapon pa po ng umaga, Dok.
Na-check mo na ba temperature mo?
Care is just a call away. With MaxiCare's 24/7 teleconsult service, every MaxiCare principal member and their dependent gets free expert medical consultation from reliable MaxiCare partner doctors anywhere at any time. Sa MaxiCare 24/7 teleconsult service, ang alaga parang nariyan lang. MaxiCare.
Si Mama, unlimited ang pagmamahal. Kaya unlimited din ang pasasalamat ko sa kanya. It's time to give back with MaxiCare Prima Gold, the affordable prepaid health card for senior citizens.
Pag na-aksidente, sagot ka ng e-Ready, ang first prepaid emergency health card from MaxiCare. Sagot ang sakit ng katawan, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-Ready.
Kanina pa masama yung pakiramdam ko. Ubo. Sipon. Masakit ang ulo. Nilagnat na rin yata ako. Sa tingin ko, hindi ko na kaya pumunta sa ospital. Dok, anong gagawin ko?
First of all, you really need to rest. Kailan nagsimula ang pananakit ng ulo at pag-ubo mo?
Kahapon pa po ng umaga, Dok.
Nag-check mo na ba temperature mo?
Care is just a call away. With MaxiCare's 24/7 teleconsult service, every MaxiCare principal member and their dependent gets free expert medical consultation from reliable MaxiCare partner doctors anywhere at any time.
Sa MaxiCare 24/7 teleconsult service, ang alaga parang nariyan lang. MaxiCare.
Si Mama, unlimited ang pagmamahal. Kaya unlimited din ang pasasalamat ko sa kanya. It's time to give back with MaxiCare Primo Gold, the affordable prepaid health card for senior citizens.
Good morning, MaxiCare members, and welcome to the third webinar of Maxi Live, a MaxiCare Wellbeing webinar series. Today, it's going to be about basic COVID-19 tips and prevention with Dr. Cybele Abad. And this is brought to you by MaxiCare as part of their mission to help you live your best life. I'm Patricia Bermudez-Hizon, and I'm really excited to be learning with you and hosting parts of this event. Now, I'm looking forward to hearing from Dr. Art Libao of MaxiCare, who will kick off this program, immediately followed by the talk of our expert, Dr. Cybele Abad. After her discussion, we will be joined by Dr. Nicole Songco Perreras, who will facilitate the Q&A with Dr. Cybele. Now, make sure you stay till the end because I am certain that this talk will help you get through this pandemic. We already would like to express our heartfelt gratitude for your patience in today's event. Our hearts are really full already with the great turnout we're having here in our Zoom, and we still have some minutes to go before we officially kick off this event. And people I can see are still logging in. So welcome everyone for those of you who are just joining us now. Now, to ensure a systematic flow, meaningful interaction, and the best overall webinar experience we can provide, we humbly ask for your cooperation in following this event's guidelines. To get and make the most of this webinar experience, please do dedicate an undivided attention to the speaker and ensure that you're physically in an area without potential interruptions and noise. Avoid multitasking and address any internet connection issues before we officially begin. Now, let's also observe Zoom etiquette and best practices. At this moment, your video and your audio settings are disabled, and we just want to make sure that you are renaming yourself. So we encourage you to do that. Please rename yourselves right now and put your first and last name. Can you do that right now? Can you actually rename yourself? I see some people changing their names already. Thanks so much for doing that. You guys are quick to respond, and I already appreciate those who have already renamed themselves prior to joining. Thank you for doing that. Now, this webinar may provide subtitles or closed captioning for your convenience in recalling important highlights. Kindly check your settings now and set the subtitle size to the size that you're comfortable with. The settings can be found when you hover the mouse at the bottom of the Zoom room. So you can check that. You'll see a button there that says subtitles or CC, and you guys can change the size there. You can also adjust the size of the window of the panelists and the window of the document that's being shared. Now, in between the window you're seeing me on right now and the window with the instructions beside me, there is a border in between, and you can actually click on that and move it from side to side or toggle it so you can adjust the size of the screen to your liking. Now, engage with the speaker and feel free to ask questions during the Q&A via the Q&A box that we have provided for you. You may send your comments, questions, and other concerns through the Q&A box while the presentation is ongoing, but please note that your questions will only be answered during the Q&A portion, so maximize the use of this box in the room. Note that the questions may be answered through the Q&A box by our staff or answered live by the speaker. So again, make sure you rename yourself so you can be properly addressed. If your questions are not answered, you may send an email to maxicarewebinar@maxicare.com.ph, and our speaker will respond to your questions after the event. Now, unruly and disruptive behavior will not be tolerated, as this may affect other participants' webinar experience. Now, if you like today's session, you can share your thoughts after the event through your social media accounts using the hashtags MaxiCare MaxiLife Webinar and the hashtag Live Your Best Life. And please, don't forget to tag MaxiCare using their social media handles. On Facebook, it's at MaxiCare Healthcare Corp. On their official IG, it's MaxiCare Healthcare, and they also have a health and wellness IG at MaxiCare Health and Wellness. Now, we'll be sending out a survey form after the event, and we will be giving away raffle prizes to those who complete the survey. So again, it's going to be a raffle, so complete your survey. Make sure that you do that. Now, we are just so excited to get going, but before we finally start this event, we will have a quick series of poll questions para sa inyo lahat. Now, all you need to do is click on the answer that best suits you as fast as you can. Stretch muna kayo. Dapat ready kayo. Ready to answer the poll questions? Click lang sa mga sagot na gusto nyo. Here's the first poll question. My first poll question to you is, how are you feeling right now? Okay naman, sakto lang, or feeling grateful pa rin, or happy ako, parang ako, happy ako, or hindi ko mapaliwanag. Sino kaya dito ang hindi mapaliwanag kung anong nararamdaman nila right now? And I can't wait to see the results here. And most of you are feeling grateful. I am glad. Thank you for sharing your thoughts with us through our first poll question. We have a second one. Ito napaka-importante sa akin. Ilang beses ko na inulit sa isip ko to. Ano kaya ang superpower na gusto mo magkaroon ngayon? Gusto mo ba para makatravel ka ulit? Teleportation? Para mapagaling na ang mga may sakit? Gusto mo the power of healing? Or gusto mo bang magka-jowa na kung wala ka pang jowa? Love and attraction? Or kung may asawa ka, tuloy-tuloy lang na love and attraction? O gusto mo ba the golden touch kasi medyo gipit? Ano kaya? Ayan, healing. That's why you're here. You know, I really love this answer. Healing para mapagaling na ang lahat. Good job, guys. Ito naman ang susunod nating poll question. Ngayong quarantine period, ikaw ba ay naging halamam, kaya naglabas ako ng halaman, halamam or plantito, quarant chef, naging online seller ka ba, fitness enthusiast, o naging avid viewer ng series at K-drama sa Netflix? Aber, ano ba ang naging transition para sa'yo ngayong quarantine period? Ano kaya? Siguro mga madami dyang halamam. Ayan, naging avid viewer ng K-drama sa Netflix and other series. O sige, we'll try to make it more productive for you guys. Ito, seryosong tanong. Ano ba ang number ng electric fan mo ngayon? Number 1, number 2, number 3 ang electric fan, or number 4 yung electric fan, or ano ka ba? Ano ka ba? Naka-aircon ako ngayon. Sige nga, sino dito naka-aircon? Or ang lakas-lakas ng electric fan, lumilipad yung buhok. Number 1, steady lang, pero madami rin nagsasabi, ano ka ba, naka-aircon ako ngayon? Gusto ko yan. Thanks, guys. nakakatuwa yung questions, di ba? But really, we just wanted you to be a little bit more relaxed. Para naman makuha natin lahat ng mga information that we will be sharing with you. So it looks like you're all raring to go. Once again, welcome to Maxi Life, MaxiCare Wellbeing Webinar Series. And this event is made possible by MaxiCare. This session, titled Basic COVID-19 Tips and Prevention with Dr. Cybele Abad, will get practical pointers on COVID-19 prevention, discover tips on how to make safety and security a part of your daily habits, find relevant information and data on the current state of COVID-19, and learn how to differentiate COVID-19 misconceptions, myths, and facts. With everything that is ongoing right now, not just in the country, but in the world, this talk will bring us essential information. We are grateful that MaxiCare put this talk together because they really want all of you to live your best life by being healthy. Now, to give us his opening remarks, here is Senior Assistant Vice President, Provider Relations Department, and Deputy Medical Director of MaxiCare, Dr. Art Libao. Please welcome Doc Art.
Good morning, everyone. Welcome to our Maxi Life webinar series. Our topic today is basic COVID-19 tips and preventions. Coronavirus is mankind's public enemy number one. To date, 22 million people have been infected worldwide, with 777,000 deaths. 2,681 Filipinos lost their lives to COVID. Now more than ever, we need to provide the necessary awareness and the needed interventions to help minimize transmission and hasten the flattening of the curve. It takes our collective efforts to win this war against COVID. As a start, we need to separate fact from fiction so that we do not propagate baseless, careless, and useless statements that may do more harm than good. Today, our speaker will share evidence-based recommendations and give you practical tips to prevent being infected. Hopefully, what you learn today, you can apply to yourselves and share with others. MaxiCare's mission is to help you live your best life. Stay safe, everyone. Thank you and have a great day.
Thank you so much, Dr. R. Truly, MaxiCare is going above and beyond for its members to deliver on its promise. And this is really part of what you do for your valued members. Now, time to get to the meat of things. As I mentioned earlier, I encourage you to follow our guidelines so you can fully enjoy your experience for this seminar. And don't forget the Q&A button that you can use after the talk. Now, our speaker today is an infectious disease consultant for the Medical City, Infection Control Committee Chair for the Medical City, research collaborator, assistant professor at the Mayo Clinic, and clinical associate professor at the Philippine General Hospital. Her thorough training and experience in infectious disease and control is crucial in providing practical pointers on how to integrate COVID-19 prevention habits into your regular routine. So ladies and gentlemen, I'm looking forward to this talk with Dr. Cybele Abad. Hey, Doc Abad, thank you so much. We're so looking forward to this discussion. Take it away.
Thank you. Good morning, everyone. Thank you for inviting me to this webinar. I was asked to talk about and give you some updates on COVID-19. And the following is the outline of my discussion. We will talk about transmission of COVID-19, tips on prevention, go over vaccines, which is a very hot topic right now, and then finally end with myths and facts before I end with some very important take-home points. So let's talk about transmission first. So the transmission of COVID-19 is really all about respiratory secretions. The big controversy is whether or not it's droplets or aerosols. And we'll talk about that in the next few slides. But imagine this person in red with COVID-19 and he's coughing. So when he coughs, he releases many, many droplets and they contain virus and they may circulate in the air for a little bit. If you're close enough, then these droplets can land on your nose or in your mouth and enter your respiratory tract. Now, these droplets can also land on surfaces. And when they land on surfaces, and if you touch these surfaces with your bare hands and forget to wash your hands, then you can also accidentally transmit them to yourself when you touch your nose, your mouth, or your eyes. So these are the two main modes of transmission of COVID-19, through droplets or through fomites, so through contact. Now let's talk about aerosols. That's the big question these days. Can COVID-19 be transmitted via aerosols? And what's the difference between aerosols and droplets? So aerosols are simply smaller in size and can travel a greater distance because they're smaller. So they typically travel more than 6 feet. Droplets, as the name implies, can drop to the surface, so they're kind of bigger, and so they tend to drop to a surface faster than aerosols. Regardless, both aerosols and droplets are transmitted via respiratory secretions. So now there's a lot of controversy still. No one can really say for sure whether or not COVID-19 can be transmitted via aerosols. So because we're not sure, there's what you call the precautionary principle. In other words, it's better to be safe than sorry. And so that's why we're asking everybody to mask up for the next few weeks or the next few months, depending on how this pandemic goes. The transmission of the SARS-CoV-2 virus is transmissible 1 to 2 days before symptoms appear. And we'll talk about the different types of people who may have COVID-19. So there are some who are totally asymptomatic, meaning they're not coughing, they don't have any sore throat, they don't have any sniffles, they feel well, but they could still have COVID-19. And then there's what you call pre-symptomatic, meaning they don't have symptoms for 1 or 2 days, but after 2 or 3 days, they develop cough or any other symptom. That's what you call pre-symptomatic becoming symptomatic. And the ones that you hear about the most are those that are symptomatic. So they're coughing, they're sneezing, they have a fever, they're having difficulty breathing. So all these types of individuals may have COVID-19. And when you do have COVID-19, unfortunately, you can accidentally infect 2 or 3 other people on average. Now, there are also what you call super spreaders, meaning you can transmit to more than 3 people. But thankfully, those super spreaders are few and far between. So on average, someone with COVID-19 can infect about 3 people altogether. Now, the good news is that exposure does not automatically mean infection. You can only be infected through close contact or direct exposure for more than 15 minutes with a COVID-positive patient or their secretions. So let's look at that diagrammatically. So let's say this COVID-positive individual is coughing and exposed P1, okay? Now, person 2 is not directly exposed to the COVID-positive patient, but is exposed to this P1. So what do you do with 3 of them? So for this COVID-positive individual, since he's symptomatic and he does have COVID-19, you would isolate him for 14 days. This person who is directly exposed to this COVID-positive individual will have to be quarantined also for the next 14 days. But this one who was never exposed to the COVID-positive patient, but exposed to that one P1, does not have to be quarantined. So he can go about freely about his day. Okay. Now, what's new about transmission? Now, there's new data coming out that asymptomatic persons shed about the same amount of virus as symptomatic people do. But whether or not this contributes to transmission of infection is still unknown and uncertain. But following the precautionary principle that we talked about, let's all be careful and assume that they do. So now that we know about transmission, we can help prevent COVID-19, understanding the principles of transmission. So there are 4 main tenets now of preventing COVID-19: hand hygiene, social distancing, frequent disinfection, and wearing your masks. And we'll go through them one by one. So let's go over hand hygiene first. So hand hygiene, tip number 1 is use alcohol-based hand rubs containing at least 60% alcohol. So if you don't know the alcohol content, then don't use that alcohol-based hand rub. Make sure it's at least 60%. Second tip, when you spread the alcohol-based hand rub on the surface of your hands, it should take at least 20 seconds to dry. If it dries too fast, it means you put too little an amount. So you have to put more. Now, if you wash with soap and water, wash the whole surface of your hands. It takes about 20 seconds for good hand washing. You don't simply wet your hands, you have to wash them. A good tip is you can sing happy birthday twice, and that's about 20 seconds. Or if you're tired of singing happy birthday, you can actually go to this website over here and change your lyrics, and it will sing you a song when you hand wash. Okay, so some strategic places where you might want to put an alcohol-based hand rub. So by the entrance to doors, and this is offices or hospitals, things like that. By your desk, so I have one by my desk right now. By your kitchen, so before and after eating, you're reminded to wash your hands or at least place alcohol-based hand rub. And by elevator buttons or by the restroom doors. Also remember these following things. So bring your own disinfectant spray or alcohol-based hand rubs or wipes wherever you go. Always properly dispose potentially contaminated materials such as your gloves, for example, or your masks. Put them in properly marked bins. And then finally, for those of you who like to wear gloves outside, that's okay, but remember that these gloves can also be contaminated and can get easily soiled, so you must also decontaminate them and spray them with disinfectant. Now let's go over social distancing. From hand hygiene, let's go over social distancing. And I'm sure you've heard this again and again. So the tip 1 is the farther you are, the better. And now you know that 2 meters or 6 feet is ideal. And why 6 feet? Remember when we went through transmission, on average, your aerosols and your droplets travel about 6 feet. So that's why that's the ideal distance between 2 people. Now, how can you tell if you're 6 feet apart? We don't really go around with measuring tape, measuring if you're 6 feet apart from other people. So I thought of some practical tips. So if you take 2 grocery carts together this way, that's about 6 feet apart. If you're a basketball fan, and if you remember your basketball idols, so for example, if you think about Kobe Bryant, he's about 6'6". If you think about Michael Jordan, he's also about 6'6". If you think about Steph Curry, he's about 6'3". If you're older and you are from the 80s or the 90s, then maybe Iverson is 6'1". So remember your basketball idols, and they're about 6 feet and above. Or if you're walking on the sidewalk, it's about 3 feet in width, 3 to 4 feet in width. So you have to add maybe 2 or 3 more feet to the width of the sidewalk in order to be 6 feet away from someone. So these are practical tips in terms of how to remember 6 feet apart. Now, what if you have face-to-face meetings? We're starting to open up, we're back to GCQ, and perhaps you'll have to go to the workplace to have a face-to-face meeting with someone. Be sure to retain the names and contacts of participants for at least a month. If someone during the event is suspected to have COVID-19, inform the participants as soon as possible and have them quarantined. Do not keep it a secret. It's really not meant to blame other people. It's really meant to inform people so that they can be safe as well. Now let's go over frequent disinfection. Now, coronaviruses live on surfaces, and there's many types of coronaviruses. COVID-19 or SARS-CoV-2 is a form of coronavirus. So tip number 1 is you can leave it alone for 5 days. If you can leave it alone for 5 days, the virus will die on its own. However, if you need to touch the material, so paper, for example, or money, or groceries, then you disinfect. If you disinfect them with the appropriate alcohol or even bleach, the coronavirus will die in about 1 to 2 minutes. Disinfect frequently. So maintain your regular housekeeping practices. Clean and disinfect surfaces and other elements of the home or of your work environment frequently. Again, use 70% alcohol this time, or do-it-yourself bleach, and I'll show you how to dilute bleach properly, and disinfect at the end of each day or at the end of each shift as appropriate. Target the disinfection of high-touch surfaces. What do I mean by high-touch surfaces? So doorknobs, for example, everybody's touching doorknobs to go in and out of places. Your cell phones are high-touch. You're always on your cell phones. You always put them down everywhere, so always try to wipe them off. Your desk space, elevator buttons, your mouse, and your keypads or your keyboards are always being touched by yourself or other people, so try to remember to wipe them off frequently. So tip 3 is do it yourself. So alcohol can be a bit more expensive. So if you have Zonrox or Clorox, that's very cheap. So 1 bottle will last you a long, long time because you can dilute it. So this grayed out portion here is 1:10. That's the stronger dilution we use in the hospital because we use it for a lot of body spills. And so it's a little bit stronger. But the one dilution that you can use at home and that you can use in the workplace, it's safer, but it's also effective, is a 1:100 dilution. So you can start off with a 1:10 stock, dilute it again, 1:10, and you can get a 1:100. Or you can simply dilute 1:100 right away. So for example, 1 ml of bleach plus 99 ml of water, that's 1:100 dilution. And remember to use it on surfaces or equipment. It's not to be used on skin or on your hands because it can be caustic or harmful. So now let's move on to masks. And I think this is kind of the in thing right now. So why wear masks? You really have to wear masks, whether they're cloth face coverings or surgical masks, to prevent yourself from spreading your own respiratory droplets when you talk, when you sneeze, and when you cough. Since people may spread virus before symptoms start, or even if they're never symptomatic, like I mentioned, wearing your mask will protect others around you. So when you cough, when you breathe, when you sneeze, you don't realize you're actually releasing droplets. So when you breathe, for example, you release about 50 to 500 droplets already, and some of these may contain virus. When you cough, you release about 3,000 droplets. And when you sneeze, especially if it's a big sneeze, you can actually release up to 1 million droplets, spreading the virus that way. So now there's a no mask, no entry policy everywhere we go. And I think it's a very, very good policy. If you look at these graphs over here, the ones in red are the countries that did not advocate the use of masks in the community earlier on. So that's the United States, that's Brazil, that's the UK, that's Italy. So they're kind of in trouble right now because they have millions and millions of cases. But if you look at our neighboring countries, so South Korea, Singapore, Japan, Hong Kong, they've advocated the use of masks very early on, and look, their numbers are much less, and they're able to control the virus very well in the community. So we should follow their examples. Now, if you wear a mask, remember that it won't work if you don't wear them well. So these are some do's of mask wearing. Remember to wash your hands before handling your mask. Inspect them for any tears or if they're soiled, and don't wear them anymore if they're broken or they're tears. Make sure you wear them and that they're a snug fit. Cover both your nose, your mouth, and your chin. Once the mask is on, do not touch the surface of the mask, so the cover of the mask, because that's where it collects the droplets. When you're about ready to remove the mask, then wash your hands again and hold the mask by the straps, again, not by the center of the mask. Inspect it again and throw it away if it has any tears. If you're planning to reuse the mask, then put it in a nice resealable container, such as a Ziploc bag, for the next use. If you're wearing a cloth mask, I would advise that you wash them on a daily basis. So you should have maybe 2 or 3 cloth masks so that you can have one to wear on a daily basis. And then again, wash your hands again. Now, which mask is best? And this is a nicely done study. So these are different masks. So this mask, this one over here, there's no mask. So remember when he's speaking, you look at the droplets over there, quite a number. If he's sneezing, look at all those droplets which may contain virus. This is a 1-layer mask. So note it immediately decreases the amount of droplets, but not so much with sneezes. If you wear a 2-layer mask, and these are cloth masks, so they work very well. So remember to layer your masks if they're very thin. And the last one over here is a surgical mask, so hospital grade mask. And look, they work pretty well. Even with sneezing, just a few droplets are released. Remember, it's not zero. So what kind of fabric should you use if you're wearing cloth mask? Cotton seems to be the best fabric of choice, but multiple layers, as I mentioned, may be needed. And the way you can tell is if you can easily see through the fabric when holding it up to a light. If it's too transparent, then you may need more layers of that particular mask. Make sure it's not too thick, however, that it causes difficulty breathing. Now, do fabric masks work? I guess that's the big question. Another way of looking at it is this one. So out in the community, there were 2 hairstylists with COVID-19 who spent at least 15 minutes with 139 clients. Now, everybody wore face coverings, and now no clients are known to be infected. So cloth masks do work as well for as long as you consistently and correctly wear these masks. Now, what about face shields? I think the government has just released a law or an ordinance at least to wear face shields when commuting or everywhere we go. So the most effective face shields actually should extend below the chin, right? So it should cover both the nose and the mouth. And what's nice about them is that they're endlessly reusable. They simply require cleaning with soap and water or common disinfectants on the surface. And they're also more comfortable to wear than masks because they actually disallow you from touching your face. So other tips. Now, prevention applies everywhere. Assume everyone may be infected, again, even those without symptoms. Unfortunately, COVID-19 can affect anyone, adults, older adults, even children. So always follow the same prevention rules wherever you go. Remember, hand hygiene, social distancing, frequent disinfection, and wearing your masks. And don't let your guard down. This one I notice a lot in the hospital, at home. Don't let your guard down during eating time. So remember, when you're eating, you remove your mask because you're feeding. And sometimes you socialize a lot when you're eating and you spend about an hour with some other people. So remember that you're not protected when you eat. Don't let your guard down when you go to the bathroom. Some people tend to spend a lot of time in the bathroom. You know, they comb their hair, they brush their teeth, they socialize in the bathroom. Remember again that your masks are typically off in these places. And at home, unfortunately, this is probably the only safe place that we have left. But sometimes, especially if you're high risk, so for example, if you're a frontliner, try to not let your guard down and maybe distance yourself from the vulnerable population. So if you have elderly people living with you, don't interact with them very often if you're high risk or if you're symptomatic. So in terms of commuting, so again, now everybody should be wearing their face mask and their face shield, but don't forget to disinfect. Bring your disinfectant wipes or your sprays, or try other options. So biking and using your scooter are both healthy and you're by yourself typically. And also motorcycle riding, you can do that as well. Or if you all belong to the same social bubble, then you can carpool. Remember that ventilation is also prevention. Being in an enclosed space and sharing the space for a prolonged period increases your chance of both exposure and infection. So what are some of these high-risk areas? So these are some high-risk areas with poor ventilation sometimes. So the workplace is a high-risk area or can be a high-risk area. Restaurants, especially if they're small and crowded. Even our churches, sometimes, if they're old, they're not well ventilated. There are no windows, for example, sometimes. Or indoor sports. So if you're playing basketball indoors, or if you're a boxer or a wrestler, these are some examples where outbreaks have been known to occur because of poor ventilation and close contact. Now, if you have to go to these places, make sure the areas are well ventilated. Still practice social distancing. Remember the 6 feet tips that I talked about and wear your masks. And then bring disinfectant sprays for hand hygiene. Now, how do we deal with COVID-19 at home? I think some of us have dealt with either parents or loved ones or family members or relatives with COVID-19. Number 1 tip is identify and isolate potential infectious individuals right away. That's step number 1. So how do you do this? Everybody should be assessing themselves continuously. So monitor for signs and symptoms of COVID-19 on a daily basis, not just today, but tomorrow as well. And what are these signs and symptoms of COVID-19? Some develop cough, some develop fever, chills, muscle pain. Some have difficulty breathing, some have a sore throat. I've come across many who have lost their lost their sense of taste or lost their sense of smell. Now, all these can occur in combination or sometimes just 1 or 2 of them. Now, once you have symptoms, immediately move to a location away from others. So isolate yourselves, consider a separate room to serve as an isolation room, use a separate bathroom if possible if you have one. Already restrict interaction with other members of the household. There should be no visitors allowed, and try not to interact with a vulnerable population, especially if you have symptoms already. Now, I think this is very important as well. Have yourself tested, but do not wait for the test results to come back. Assume the test is positive, because sometimes the test can take anywhere from 1 day to about 7 days. So you lost 7 days if you've interacted with the rest of the household. So isolate yourself immediately while waiting for the test. Now, what's the best test? So the best test for diagnosis is really your PCR test, which is what you call the swab test. It looks for the genetic material of the virus, and it's confirmatory. So it's really the best test that we have for diagnosing COVID-19. If it's positive, if it's confirmed. If it's negative, it's most likely negative. Note that the antibody test down here is really not for confirming COVID-19. And if you have questions later, I'll be happy to answer some of those questions. Now, when is the best test? So we talked about what is the best test. So when is the best time to get tested? When you have symptoms that we talked about, or if you're exposed but are still asymptomatic, if you have yourself tested about 5 to 7 days from exposure, then that's a good time to get tested as well. Next tip, now the rest of the household must be considered exposed and must be quarantined for 14 days. So they're kind of stuck with you in the household, but in separate rooms. Now let's go over myths or facts. This is a myth that kind of circulates. Eating hot pepper and garlic can prevent COVID-19. The assumption here is that if you eat something hot, that can kill the virus. And unfortunately, this is a myth. Once the virus is in you, no amount of hot food or coffee or pepper or garlic can kill the virus. It will replicate on its own. Next one, UV light is useful to disinfect your hands or your skin. This is again a myth because UV light is intended to disinfect surfaces. Now UV light does work and it does disinfect, but it is not meant to disinfect your hands or your skin. It can be harmful. It is meant to disinfect surfaces or equipment. But caution on the use of UV light. Despite the potential for commercial UV use, a lot of germicide experts, so experts who have really studied this, have little faith in home products that are available on Shopee or on Lazada. There's really not enough evidence for them, and there's a lot of room for user error. Remember that UV light can cause keratitis. It can cause cancer also if you expose yourself too much or for too long. It is also unlikely that quickly scanning a surface with a surface UV light, for example, with a handheld device, will do any significant damage to viruses or bacteria. Next one, rinsing your nose with saline or gargling mouthwash can prevent COVID-19. I wish this were true, but this is also a myth. Again, if the virus is already inhaled or already replicating in your throat or in your respiratory system, no amount of gargling or no amount of mouthwashing can kill the virus. This one, exposing yourself to the sun in hot, humid weather prevents COVID-19. As we all know, the Philippines is very hot, and yet we have more than 160,000 cases now of COVID-19. So this does not work as well. What the virus likes is your internal body temperature. So your internal body temperature is regulated very well by your body at about 36.5 to 37 degrees Celsius, and that's what the virus loves. It does not care about the external temperature. So whether it's very hot or very cold, it does not matter to the virus. So that's a myth as well. Now, the next question I typically get is, can you get reinfected? And the short answer is, no one is sure. So we are still not sure about this. There's unfortunately no evidence that people who have recovered are protected from a second infection. But recent articles are coming out saying that we are able to measure antibodies, so that's a good sign. But whether or not these are protective antibodies or neutralizing antibodies is unknown. And for how long they're protective is also unknown. So we are not sure if we can get reinfected with COVID-19. Now let's talk about vaccination. And this is, I think, the last topic before I give you your take-home points. So is there a vaccine? Vaccine development takes months to years ordinarily. So it takes about 10 to 12 years to develop one vaccine. But in times of pandemic, this can be accelerated. And we expect a vaccine in the next few months. No, not today, not tomorrow, but in the next few months. And it may be available under emergency use protocols in late December, hopefully, or in early 2021. So why are we hanging our hats on a vaccine? One is because they're hopefully to protect people before they're exposed to the virus, so they're really for prevention. Next is that so we can train our immune system to recognize COVID-19 and attack the virus when it encounters it, so to decrease or minimize the risk of having severe disease if we're exposed to COVID-19, to protect the person who's vaccinated and as well the community, and eventually develop herd immunity. The herd meaning all of us eventually will be protected from COVID-19. So what are vaccine phases? In order to understand how vaccines are made, you have to understand that they're made in phases. So there's actually 4 phases: a preclinical trial done on animals. So they test it first on animals, and then they do human trials. Safety trials first on just a small number of people, and then hundreds of people. So that's phase 2, looking at both safety and efficacy, meaning does the vaccine work? And then finally, phase 3 trials, now giving it to thousands of people under, again, clinical trial before you release it to everyone else, because you want to make sure it's both safe and effective for everyone to use. Now, who are studying vaccines? So a lot of people are putting money into vaccines. There's a lot on preclinical trials, right? There's 8 on phase 3, and now 2 have been approved. But let's look at the approved vaccine. One vaccine I'm sure you've heard on the news is the Russian vaccine, right? So remember that it was approved for early use, but it actually only went through phase 1 trial. So the question is, do we want to use a vaccine that's only been through phase 1 and has not really been through phase 2 and phase 3? So that's kind of the big controversy there. Another point I wanted to make with vaccines is that it does not mean that COVID-19 will immediately disappear once we have that vaccine. It is not a cure. And it may or may not be effective. Some vaccines are very effective. So measles vaccine, for example, is about 90% effective. The flu shot varies effectiveness from about 25% to 80%, depending on the year and the match. So it really depends on the vaccine. So we cannot hang our hats on this particular vaccine. And again, once it is available, it does not mean we no longer have to practice infection control and some of the principles that we talked about. So finally, some take-home points. Again, the virus is transmitted largely through respiratory secretions, whether aerosols or whether through droplet is still controversial, but largely through respiratory secretions which can land on objects, so that's contact spread, or through fomites. Prevention tips are really based on the mode of transmission of the virus, and so that's why we keep on talking about hand hygiene to avoid contamination of fomites, disinfection, social distancing, and wearing masks to avoid spread through droplets or through aerosols. Remember the high-risk areas and events we talked about. So poorly ventilated areas, small areas with no ventilation, and if you're there for prolonged periods of time, so try to avoid them or decrease your risk by practicing the principles we talked about. Isolate and quarantine early, especially if you have symptoms. Do not wait for the test result to come back. The best test really is that for diagnosis is your PCR test or the swab test. And vaccines are thankfully on the horizon, but they are still in phase 3 trials. The Philippines is actually a site, so we'll be starting phase 3 trials in our country very soon. But we have to be careful about these vaccines. And that's my last slide. Thank you very much. And this is kind of a drawing of my son showing his battle against COVID-19.
Wow. Thank you so much, Doc. Wow, that was really, really informative. Thank you so much, Doc Cybele. You know, it's really important to get to listen to experts such as Dr. Cybele right here, instead of relying on tips that are usually passed on on social media, because so many of those really do not have medical basis. Now, I have so many questions running through my head right now, and I'm sure kayo din ang dami nyo ng mga tanong. This is now the time to ask your questions using the Q&A button that we have at the bottom. Now, if your questions are not answered here, you may send an email to maxicare@maxicare.com.ph, and our speaker will respond to your questions after the event. For now, please do allow me to call on someone who will facilitate this Q&A. This webinar's moderator is a diplomat of the Pediatric Infectious Disease Society of the Philippines. Her knowledge on pediatric infectious disease will be essential as she helps you get the most out of this session with Dr. Cybele. So please help me welcome Dr. Nicole S. Perreras. Dr. Nicole?
Hi, good morning to everyone. Doc Cybele, thank you so much for such a comprehensive lecture, and I'm so happy you were able to help us like with specific day-to-day activities, especially commuting, eating with our co-workers, and how we can really prevent ourselves from getting the infection. So there are a lot of questions from our audience. So do you mind? We'll jump right in. So the first question from one of our viewers was, can the flu or pneumonia vaccine prevent COVID-19, and why does it always come up in discussions about prevention?
Yeah, that's a very good question. I wish the answer were yes, so that everybody would get their flu and pneumonia shots. But the answer is no. The flu and pneumonia and COVID-19 are all very separate. So having a vaccine for one does not protect you from the other, unfortunately.
Okay. So next, you know how sometimes we really can't avoid having to go out of our house and we have to go to the hospital. So we have a question from one of our listeners. She has to go to therapy pretty regularly in the hospital. So her question is, do you think it's safe to go to hospitals? And part two of that question is, what does she do when she gets back and she's amongst her family at home?
So it's a little bit ironic, I think, because people think that a hospital is unsafe, but it's probably one of the safest places you can go to, because hospitals really have a very good protocols in place in terms of COVID-19, and everybody is extra careful in the hospital, I think. So everybody's wearing their masks and their shields and doing hand disinfection and practicing social distancing. So I think, to answer the first part of the question, going to the hospital is very safe because as the viewer mentioned, some people do need to go to the hospital on a regular basis. So I think it's a safe place to go. And number two question, the second part is when you're going back to the house. That's a little bit more difficult to answer, but I think if you practice hand hygiene and do a change of clothes and maybe take a bath before interacting with your household. That's what I do, for example, in practice. Before I interact with my family, I just take a bath and do a change of clothes when I get home. So those are some things you can do coming from the hospital.
Okay. So, Doc Cybele, we have a couple of questions regarding masks. So one is, one of our listeners has a friend who's a nurse who told her that a cloth mask will give her no protection at all. So she was advised to only use a surgical mask or the N95 mask. So what's your take on that? Because that's not readily available and honestly quite expensive.
Right. And yeah, so in a way, the hospital care worker is right in a way, no? But I think the problem is the answer is kind of in the gray zone, no? I think as I presented, it's really a gradient, no? So really the most protection is afforded by the N95 mask. That's correct, no? But the problem with the N95 mask is, number one, it's in short supply. Number two, it's very expensive. Technically, you have to wear one every day and change one every day, you know? But I disagree that cloth masks afford zero protection. As I mentioned, no, there's evidence now showing that it can really provide some protection. No, maybe not as much as an N95 mask, that's true, but enough protection to help prevent the spread of virus. Now remember again that these are not, these tenets we use are not to be used on their own. No? So you wear a cloth mask plus a shield plus practice social distancing, so that eventually these are all synergistic, and so the amount of the probability of getting coronavirus then becomes much, much less if you practice all three. So I think cloth masks are still very useful. Remember the tips I gave you. So remember to layer, make it thick enough so that it's not too flimsy, and make sure it fits well. No? I think there's still a role for cloth masks, especially in the community.
So Doc, just as a follow-up on that, because one of our listeners was asking, so of course we mentioned the use of face shields, but can they just pick one? Like if they're wearing a face shield, is that enough? Or do they have to, if they had to choose, is one better than the other?
Yeah, so both are better. Both are better. The problem if you just wear a face shield, if you look at it, it doesn't really, it's not snug in your face, right? So there can still be droplets or whatnot that enter through the bottom, depending on how big your face shield is. No, so it's really better to do both, a face mask and a face shield.
Okay, and then another question, Doc. No, so you could be wearing already your face mask, a face shield, but there are some information that's going around that you should keep, like you mentioned, 6 feet away, but some people say, and some policies say 1 meter away. So
Yeah.
do you think is 1 meter the minimum, or what do you have to say about that?
Yeah, so that's probably the minimum, but again, the farther you are, the better. No, I think if everybody is masked though and wearing their face shields, then 1 meter should be enough. No, kasi parang everybody's protected already. No, but again, the farther you are, the better. And also, ventilation also plays into that mix. No, it's also a factor. If you're just 1 meter apart, but it's poorly ventilated, it's an enclosed space, and it's kind of a little bit scarier, no? But if you're 1 meter apart and it's an open space, you're outdoors, then it's better. So parang there are really multiple factors that you have to consider.
Okay, so I guess there are a lot of things we can do to make sure
Correct.
that, right? So Doc, what about when we're preparing food for our family members? Like, can we pass it on if we're handling their food, or is that a myth?
Yeah, so there's to date there's actually no evidence that a coronavirus is passed on through food. No, parang ingestion is not a way that you can transmit the virus. Now, however, the surfaces of the food or the surface of the container or whatnot may contain coronavirus. No, assuming someone with coronavirus sneezed on it or coughed on it or whatnot. So that's where hand hygiene is important, and wiping off the surface is important. No, but the food itself will not transmit coronavirus.
Okay. So Doc, we have one listener who's actually a COVID survivor. So her question is, right now she's 37 weeks pregnant. But last March, so that was a few months ago, she was able to conquer this disease. So her question is, will this affect her baby in any way? Or is there evidence that she can pass it on while she's pregnant?
Yeah, so that one is a little bit medyo unknown pa, no? Because I guess fortunately not a lot of pregnant women have been affected. So there's really not a lot of, we still have a lot of questions, no? But from what I know, no, given that she was affected kind of her second going to her third trimester now, then the baby should be safe. We've had some cases where the mother gave birth and the baby has been negative, no, so far, yung mga cases namin sa Medical City, for example. So I think her baby should be okay.
And there are protocols, right, Doc, in the hospital? Pregnant mothers don't have to worry when they have to go.
Yes. Yeah.
Okay, so Doc, we have a few other questions like, can body steam kill the virus, and can we use home purifiers in like a household setting? Is it safe for everyone?
So body steam, I think this is similar to Toob, no? It does not kill the virus. It will help your symptoms feel. You should feel better, no? Kasi it promotes better circulation of your nasal passages. Kind of makes you decongest yourself, no? Yun yung theory behind steam inhalation, no? But it will not kill the virus, nor will it protect you against the virus. So it's not meant for protection nor treatment, but it's meant for symptomatic well-being, no? Now the second part was for use of air purifiers at home. I use one too, and I think it's pretty safe, no? I'm not sure if it kills the virus. There's really no evidence to support it, but I feel better if my air purifier is on. So I do use air purifiers. I think to some degree it does help, but I wouldn't kind of bet on it killing the virus. I wouldn't. What would be better would be like a HEPA filter or even UV light if no one is in the room and you're just kind of disinfecting the surface but not the people. Those will kill the virus.
Sorry, Doc, so you already mentioned something about like the UV light. So do you think we should be using these UV wands or?
Yeah. So the problem with UV wands, small ones, I'm not sure if they've actually been vetted or if they've been cleared as safe and efficacious. The ones that are fully functional and you're kind of sure they work are the ones that are hospital grade. So yung parang malalaking UV lamps and whatnot. Yun, they do work, but they're meant to work on surfaces, so on the space itself. So na-on mo siya dapat pag wala ng tao. So when you're about to leave the clinic or you're about to leave the home. So don't turn it on while people are there. So they do work. But the wands kasi, I'm not sure kasi parang you can buy them for so cheap and then they're all marketed. So I'm not sure they work. So I'm not sure if they're vetted very well. So that one is rather controversial.
Okay, Doc. So from one of our listeners, are there any vitamins they can take or we can take to make sure that we or lessen the chance of getting sick?
Yeah. So I know a lot of people have been talking about, the Chinese medication and vitamins and supplements. The bottom line really is there's really no evidence that it helps prevent SARS-CoV-2 or COVID-19 per se. No, but in general, like vitamin C with zinc will help in terms of general protection, no, from common cold to COVID-19, but it's not specific. So parang you don't take it just because of COVID-19. You take it in general for general health and well-being, no? Because if you focus solely on COVID-19, there's really no evidence to support it. But for general health, I would recommend maybe just taking 1 or 2 vitamin C's with zinc a day to help our immune system somewhat, no, to help battle whatever virus is out there. But it's not specific for COVID-19.
Okay, Doc. So another question. What if you're exposed to an infected person or they've been discharged from the hospital and they're recovering at home? So how long until they can say, that they're not infectious anymore?
Yeah.
So do you have any guidance about that?
Yes. So the guideline now is 14 days, no? 14 days must include 3 days without symptoms, no? So kung kunyari may symptoms ka pa on the 13th day, then maybe extend it a couple more days until may 3 days ka na without symptoms, no? That's when you're sure that the COVID-19 individual is no longer infectious, no? So that's why the mantra everywhere is about 14 days. Kasi typically, better na talaga ang mga COVID-19 individuals. Now, there are some exceptions to the rule. So for example, people who have been critically ill with COVID-19, mga na-ICU, or those who are immune compromised, or those with cancer, or those who are on hemodialysis. We want to give them a bit more leeway. So for them, we actually extend it to about 21 days before they can reintegrate back to the community or back with other COVID-19 negative individuals.
And they would need a clearance, right, Doc, from their physicians to say that, they to their...
Yeah. Typically, they get clearance from either the local health unit. Sometimes they'll be given clearance, especially if they just stayed at home or in a quarantine facility, or the local BERT. There's an emergency rapid response team locally, or sometimes the hospital or the physician.
Okay, Doc. So I know you kind of touched on this, but we have a question about exposure. So somebody was exposed on a domestic flight, and feels like one of the patients might have been positive. So if you were exposed today, when would be the best time to get tested? I know you kind of mentioned it, but maybe just to reiterate to our
Sure. Yeah. So if you felt that you've had a close contact exposure or, with someone with potential COVID-19, so there are two things you can do. One is to get tested, and if you want to get tested, it's about 5 to 7 days after exposure. No, if you're asymptomatic, so about 5 to 7 days from exposure. Once you have symptoms, then you can get tested right away. No, or if you don't want to get tested because it's expensive or it's a hassle, then what you can do is you can quarantine yourself for 14 days. No, and then that should give you the amount of time na sure ka na hindi ka na infect and you're okay, and then you can go back to the community.
Okay. And Doc, we have a question about rapid tests. So there's a lot of things being said about rapid tests. So one of our listeners is asking, what if one of her friends tested positive for IgM and IgG? So, and she came in contact with that person. Does that mean she's really exposed, or is that person contagious?
Yeah, so I guess the bottom line is for rapid tests, no, just to clarify, because sometimes there's some confusion when you say rapid test. So the rapid antibody test kit, that's the one, just so we're on the same page, that's the one where you do a finger prick and then you get results na parang pregnancy test. No, you get 2 lines, positive IgM, IgG, ganyan. That's the rapid antibody test I'm talking about. If that's the one you're talking about, then it's actually pretty useless. No, parang it's neither accurate nor sensitive. So regardless of the results, we cannot interpret it. So ang best test really is to do a swab, as I mentioned. No, now there's an antibody test that's not a rapid test, but that is useful, especially if you're trying to document recovery. It's called the ECLIA or ELISA-based antibody test. So those are antibody tests too, and you can get them in about 24 hours. So in that sense, they're rapid, but they're usually laboratory-based. So again, parang blood draw and then sent to a lab, and then you get the results back.
Okay, Doc. So we have a couple of questions again about masks. So do you recommend any specific type, or would it depend on what's available to you? Like there are copper masks out there, there's the N95, the cloth mask. What would you recommend for general use?
So for general use, I think you can still do with your cloth mask, no? But I would recommend that the cloth mask is made up of cotton, seems to work very well, that it's not too thin, and that maybe you'll have multiple cloth masks so that you can wash one and wear the other one the next day. Because you really have to wash them on a daily basis. No? Hindi pwedeng reuse lang na reuse kasi they tend to get dirty, no? If you have either the money or if you find it, you can use surgical masks in the community. No, those are actually preferred, but they're kind of hard to find and they're rather expensive. And also there's a lot of fake masks, unfortunately, out there. Kahit yung mga surgical masks, ang dami na ring fake. So you have to be careful, no? If it's too cheap or if it sounds too good to be true, then it's probably fake, unfortunately, no? But cloth masks, I think, for the community is actually pretty good.
So, Doc, what do you have to say about, when you go out, you see a lot of people may panyo inside the surgical mask. Do you really have to do that? Or can we just wear the surgical mask per se?
Yeah, surgical mask na lang. Kasi remember, if you wear a panyo over the surgical mask, then you kind of bother the filtration layer of the surgical mask. No, parang I know it's nice to layer sometimes, but yung nalalayer lang will be cloth mask sana. So surgical masks should be standalone na lang kasi may filtration layer na siya. So it works very well by itself, no?
Okay, Doc. So last 2 questions. Do we have any data available on people who were wearing masks but still got infected anyway? I mean, is there a website that people can go to and check? I mean, I guess what this listener wants to know, it wants reassurance that, these things work.
Yeah, so, well, we have evidence that they work, but we do not have evidence that they work 100%, no? Unfortunately, walang 100%. So we do have people who have promised, no, up and down, 100% daw sila nag-surgical mask, and yet they still have COVID-19, no? And it's really the level of exposure. No, for example, in the hospital, the healthcare workers are very good about wearing their masks and their N95 mask na nga, and their PPEs, and yet some of us still get COVID-19. And we don't know where the break is really. Sometimes it might be hand washing. No, it's not the mask, but the hand washing that's the problem. Or sometimes if you're high risk, it's really the way you remove your PPEs and get contaminated. So unfortunately, walang 100%. And as far as I know, there's no website that we can look at in terms of numbers. No, kasi it's really hard to know where you got the virus or how you got the virus. No.
Okay, Doc, so there's one last question. Do you have any other information for us about the vaccines? Because it's been the Russian vaccine that's pretty, like it's been out there in social media. But do you have any info? Like, are there any other upcoming ones? Maybe better or...
Yeah. So, so the Russian vaccine is rather controversial because it skipped some steps pala and then it got approved, no? But there are actually 5 vaccines probably that are in the running, that are legitimate and that are not cutting corners as far as I know. And the vaccine trials are actually about to start in the Philippines, and we're vetting about 5 vaccines. No, different hospitals have been assigned. No, but remember, these are all still under clinical trials, so you'll have to do informed consent. No, they're not allowed to give you the vaccine without you knowing na may vaccine pala. So you're supposed to consent and say, I understand the risks of getting this vaccine, etc. But things look promising. No, I think there are about 5 vaccines that are very promising, that will not cut corners and will go through all the phases. So I think watch out. Baka by the end of the year or early next year, we might have it released now for everyone's use.
Okay, thank you so much, Doc. There are so many questions, and it really means everybody's interested. Everybody was able to learn. But unfortunately, that's all the time we had for our question and answer part for today. So I think I'll turn the mic back to Miss Pat.
Thank you so much to our wonderful doctors. Wow, you're right, Dr. Nicole. There's still so many questions, but don't forget, we are giving you an opportunity for all of our attendees here to still send us your questions via email. But first, let me thank Dr. Nicole for facilitating the all-important interaction with our attendees. That was really, really special for all of us, for myself included. I had so many questions in my head that were answered here. Now, can I just ask our attendees, all of you, to stay just for a couple of more minutes? Like I said, your questions do matter to us. So if your questions were not answered, you may send an email to maxicarewebinar@maxicare.com.ph, and our speaker will respond to your questions after this event. Thanks so much again to Dr. Cybele Abad, who shared with us really, really helpful tips to keep in mind in order for us to keep ourselves protected from COVID-19. And I certainly have a lot more clarity now. Now, guys, here are 2 quick poll questions before you go. So please do answer. Just click on the answer that best suits you. Here's question number 1. Do you want to live your best life? Yes, of course, ang sagot, or oo, syempre. And I think very, very positive tayo sa sagot na to. Do you want to live your best life? And of course, that is a resounding yes for everybody. Syempre, we all want to do that. And for you to live the best lives, here's question number 2. Which topics would you like to see in our next webinars? This is so important for us. Would you like to see a topic or attend a webinar on how to achieve a quarantine body, ways to prevent workout or burnout from work, plant-based cooking, positive parenting amidst the pandemic, or personal finance? You can actually select multiple answers. Hindi lang isa. You can select the important answers para sa'yo. And wow, so many people are wanting the topic on ways to prevent burnout from work. And this is also followed by personal finance. Of course, so many people are chiming in on their answers here, and we really appreciate your feedback on this. Now, just a reminder, we will be sending out a survey form after the event, and we will be giving away raffle prizes to those who complete the survey. So you have to complete the survey, then we'll raffle it off for all of you. Now, if you enjoyed this experience, please do share on your social media using the hashtag MaxiCare MaxiLife webinar and the other hashtag Live Your Best Life. And you can tag MaxiCare on Facebook at MaxiCare Healthcare Corp and on IG at MaxiCare Healthcare. And of course, they also have MaxiCare Health and Wellness for their other IG account when sharing about your wonderful takeaways from this webinar. Well, that ends our event for this morning. We hope you enjoyed and you were able to take away meaningful information that will help you cope during these trying times with MaxiLife, MaxiCare Wellbeing Webinar Series. Thanks again, everyone. Have a great day, and we hope that you will live your best life.
What makes a future special? Perhaps it's in what you see. And how we see it. What you hear and how we listen. And if you seek a future that's worth depending on, we've got you covered in every way. We even added a little cup of comfort. And tasteful little details to show how much you mean to us. We are moving forward. Innovating our touch of care. Making us available at any hour, at any day. So we can be more responsive. So we can be more connected. This is how we make the future of healthcare special. By making you experience you are special in every sense. We go beyond care. Experience MaxiCare today. MaxiCare Primary Care Clinic VGC is open to care for you 24 hours a day, every day. Visit other MaxiCare Primary Care Centers at these locations.
Pag na-aksidente, sagot ka ng e-ready, ang first prepaid emergency health card from MaxiCare. Sagot ang sakit ng katawan, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-ready. Pag biglang nagkasakit, sagot ka ng e-ready, ang first prepaid emergency health card from MaxiCare. Sagot ang anumang sakit, sagot din ang sakit sa bulsa. Pag emergency, sagot ka ng MaxiCare e-ready.
Si Mama, unlimited ang pagmamahal. Kaya unlimited din ang pasasalamat ko sa kanya. It's time to give back with MaxiCare Primo Gold, the affordable prepaid health card for senior citizens.
Can bring you luck or change your luck. Fight the 8 deadly diseases: dengue, malaria, pneumonia, and more. With My MaxiCare Lite, the one-time prepaid health card for hospital confinement due to the 8 deadly diseases. So luck is always on your side. Fight the 8 with My MaxiCare Lite.
Kanina pa masama yung pakiramdam ko. Obo. Sipon. Masakit ang ulo. Lagnat na rin yata ako. Sa tingin ko, hindi ko na kaya pumunta sa ospital. Dok, anong gagawin ko?
First of all, you really need to rest. Kailan nagsimula ang pananakit ng ulo at pag-ubo mo?
Kahapon pa po ng umaga, Dok.
Na-check mo na ba temperature mo?
Care is just a call away. With MaxiCare's 24/7 teleconsult service, every MaxiCare Principal member and their dependent gets free expert medical consultation from reliable MaxiCare partner doctors anywhere at any time.
Sa MaxiCare 24/7 teleconsult service, ang alaga parang nariyan lang. MaxiCare.
What makes a future special? Perhaps it's in what you see. And how we see it. What you hear and how we listen. And if you seek a future that's worth depending on, we've got you covered in every way. We even added a little cup of comfort. And tasteful little details to show how much you mean to us. We are moving forward, innovating our touch of care. Making us available at any hour, at any day.